That's too bright now? Yes. Okay. So the first thing you do is hit the function button. There is a mode. This is called AC symmetrical, so that's biphasic asymmetrical. If you hit it again. Okay, mode. AC asymmetrical, you're going to hit the up or down arrow. The other choice is HVPC. That is something else where it's not this treatment. So that's later on. It's called high volt. So your choices are AC symmetrical, which is that biphasic symmetrical, or AC asymmetrical, that's that biphasic non-symmetrical. Asymmetricals tend to be more comfortable, so why not choose that one? When you're ready, move on to the next thing. Rate, 100 pulses per second. Let's bring it down to 50. 50 is optimal for muscle strengthening. Okay, hit 50 for the rate. Duration, 250 microseconds. It's in our range. Channel order. All right, we have choices here. Simultaneous means it puts channel 1 and channel 2 on at the same time. This is a bipolar treatment, so it's just like TENS. It's alternating current. It is 2 active electrodes, bipolar treatment. But unfortunately with this machine you can't set up 2 people at once. It just doesn't let you. It's either one or nothing. So this really stinks. If you take too long, it just goes back to this screen. So if you forgot where you were, you just start hitting this thing back again. So we're on duration, we're on channel order. Simultaneous, alternating means it goes channel 1 and channel 2. Co-contraction means it kicks on, both off. Co-contraction simultaneous is pretty much the same thing. Just hit SIM, S-I-M, sorry. So for this one, just put simultaneous, S-I-M. Hit that one for the practical. Next one, channel on. We can do 5 seconds. If you want to increase or decrease, you just hit the up or down arrows. Off time, let's do 10 seconds off. Ramp up. I'm going to lower my ramp down so I get some function out of it. Ramp down. I want some function out of it. Treatment time, you can do 15 minutes, 30, 60, or continuous. So your choices are 15, 30, 60, or continuous. What I like to do is hit continuous for this, because that way the machine isn't shutting off if I need to change the intensity. This clinician values time, that means it's used 1.3 hours since the machine was bought. That's not important for you guys. And then it goes back to that mode. So then what you do is put the pads on. These are your intensity buttons here. If you have this one plugged in, channel 1, please use these for your intensity buttons. If you have this one plugged in, please use these intensity buttons. Okay? That's the JACE unit.
What was the pulse duration again?
Pulse duration's on your slide. Depends on what you are using it for. We're going to use it for strengthening, so let's follow
Okay.
that one.
Gotcha. Thank you.
Okay? So for the JACE unit, just know that one.
Okay.
So the 1 through, was it 7 points that you had here, are these for
The big unit.
all of the units then?
So let's put, this is just for the JACE unit,
So none
because
of
it's
them-
strengthening. But for the big unit, you can do it for everything else.
You can also use a big unit for strengthening.
You can, but it's not very functional.
Okay, so you'd
Because
rather
this
it
is the
be
type
big.
of machine you would use for, the anterior tib or a functional activity.
Okay,
You can use that thing, but you got to drag that cart down the hallway and it's got a cord.
I get you.
Gotcha.
So we're using that for that unit for the
Yes,
strength.
for JACE, we'll use strengthening. Use this slide for the JACE. If you choose it as a practical choice, this is called functional electrical stim, FES. That's what you use this machine for. If you want to do a functional activity, that's the only time you use this machine. for functional electrical stim training. Every other thing you're going to use that big machine.
So this one is only for strengthening.
Only for functional electrical stim, FES. So for your practical exam, it'll say do FES for ankle strengthening. Do FES for wrist extension strengthening. Those are the two things you use it in life for. Okay, so for the practical, there's two things you need to know. Anterior tib to bring your foot up for foot drop, or wrist extension for function of the hand. Those are the two ways you use it in the real life. Those are the two things I will test you for the practical. Or FES. Okay? Wrist extension.
Only for.
That's what we use it in the real life for. Because after a stroke, the flexors are very dominant, and people need to be able to pick up things. So we use it in real life for wrist extension to help pick up things, or use it for the anterior tib to prevent foot drop. Is everybody clear? Can everybody pass this on to the two people that are not here tonight? Be nice. All right. The rest of the goals, you can use it on the big machine. I promise you for the practical, we'll have strengthening goals. Yeah, that's the only one, because that's real world. And the other stuff you can look up later. For the practical, for the big machine, use it for strengthening, muscle strengthening. So like a knee surgery for quads, you can use it on any muscle group for strengthening. So just know for the practical, the strengthening parameters. Deal?
Deal.
Because that's real life. The other stuff is like a sales pitch. But don't throw it away because it could be on your boards.
Or on our written.
Or on your written test. Okay. Now the big sucker. Russian and biphasic is the big machine. Russian and biphasic